moms, it's Kristen from Action Potential, and I've been asked to talk a little bit about some of our postpartum care that we provide here in the clinic. So certainly after 9 months of carrying a baby, as many of you young moms know, it certainly wreaks havoc on the body. And we look at how that carrying of the baby has affected the variety of different structures within the body. So one of the first things we look at is the presence of what's known as a diastasis rectus. This is a small tear within your abdominal muscle that occurs as the baby is growing within the stomach. It actually separates a layer of the muscles. And we look to see if you have a diastasis rectus and then start to train some of the deeper muscles of your abdominals to help prevent that diastasis rectus from worsening, as well as to potentially help it to heal and close. So that's one of the main areas where we can help to restore your abdominal tone and core and essentially rebuild the waistline that you once had. But along with that piece of it certainly comes the other piece of postpartum care, which is through the pelvic floor. So whether you've had a cesarean section or a vaginal delivery, that can each affect the pelvic floor in different ways. Certainly a cesarean section is going to affect the function of the deepest abdominal muscles as they interdigitate with the pelvic floor. So we can often see a weakness present both at the abdomen and in the pelvic floor, even without a vaginal delivery. In regards to a vaginal delivery, sometimes with that delivery can come some tearing or cutting of the perineum through an episiotomy, and that can actually cause some pain or scar tissue to form along the bottom and along the sides of the vagina. So what we'll do is assess to see if there is any scar tissue formed and use some manual techniques to help break up that scar tissue and restore the elasticity of your vaginal opening. This is certainly important for things like having sex and having a tampon in, because we need to allow that vagina to expand and contract without pain to accept either of those objects. And then lastly is the havoc that wreaks on the pelvic floor by having a 6, 7, 8, 9, 10-pound baby resting along your pelvic floor for so long. And you can see here in the pelvis, those muscles of the pelvic floor create a hammock, and that hammock is really what holds all of your intestines and of course the baby in while you're carrying that baby. Once the baby comes out, those muscles now have to regain their normal tone and strength to help provide normal function to your pelvic floor. So we can use things like biofeedback, which is a computer assisted way to determine the strength of your muscles. Or we can do some manual therapy to help build the strength of the muscles through teaching proper Kegel exercises. And then lastly, certainly with all of that trauma to the pelvic floor, there can come deep pelvic pain, which usually presents itself with prolonged sitting or pain with intercourse. And that can come from unnecessary or irregular muscle spasms within the pelvic floor. And we can actually go intravaginally and release some of those muscle spasms in the pelvic floor to help alleviate some of that pain. So certainly with regards to postpartum care, we attack the issue very holistically to help get your body back to where it needs to be to care for your young baby, as well as potentially attend to any other children you might have, prepare you for an additional childbirth, or just help return your body to a state where you can go back to the things you love, like exercise, fitness, or whatever physical activity you enjoy. So certainly if you have any other questions, please reach out via email, or you can post those questions along with this video. But the American College of Obstetrics and Gynecology is recommending that everyone postpartum see a physical therapist to help at least even just educate about the ways that childbirth can influence the pelvic floor and abdominals. And we certainly stand by that recommendation and encourage new mothers to seek out professional care to help restore their body to the function that it needs to be. So thank you very much, and we'll look forward to talking with you soon.